Hi, I'm Hobbs. I'm going to be your student nurse today. How are you doing?
Good.
Can I ask you your name and date of birth?
Amy Jenkins, 2784.
Alright, Amy. It looks like the last nurse, I think her name is Keely, she left you up high. That's a no-no. Alright, let's get you back down. Okay, do you know what's going on today, Amy?
No.
So your dog asked me to put an IV, or not put an IV, hook up some sodium chloride and some antibiotics to your IV. Is that okay with you?
Yep.
Okay, awesome. Antibiotics are gonna help with that kidney infection, and that fluid is gonna help flush that kidney stone out. Cool with you?
Yeah.
All right. Do you have any known allergies?
No.
No. Any allergies to, like, I don't know, latex or anything that I might use today?
I don't think so.
No. Okay. Alrighty. Some things that might occur with this IV is just some side effects. Could be some nausea, some diarrhea, and possibly a weird or bad taste in your mouth. But the good news is it'll get the kidney stone out and help with the infection. Cool with you?
Yep.
Roger that. I'm gonna go get your stuff ready, and then I'll be back.
All right.
Go into the med room. In the med room. Alright. So we're gonna check the MAR. This is for Amy Jenkins, 271974. Okay. 0.9 sodium chloride. Yep. And ciprofloxacin. Okay. Administer at 1630 intravenously. 1025. Perfect. Okay. Confirm that with the physician's order. Where are you? Orders. Physician's orders, Amy Jenkins, 27, sodium chloride, ciprofloxacin. Let's see here, 400 milligrams. Okay. 10 milliliters on the sodium chloride. Alright. Okay, so now I'm going to pull out my IVs. Okay. Let's see. This is going to be for our antibiotics. 10 drops per milliliter. Perfect. This is for our antibiotics. Just so you know, Lisa, we have a hemostat over it for educational purposes. Okay, we have our saline flush. We have our other drip set. Okay, this is our primary. We have our sodium chloride. And then my math here first. So for the sodium chloride, we have 100 milliliters over 60 minutes, and our drop factor is 10 GTTs, I can't speak. This would equal 16.66 drops per minute, round up because you can't calculate half a drop. For our ceftriaxone, we have 200 milliliters administered over 30 minutes. Times that by 10. Because our drip factor on our packaging is 10 drops per milliliter, that would give us 66.66, and same thing, we would round that up to 67 drops per minute. Okay, and now that I have all of my meds out, milliliters every 4 hours. excuse me, 1 liter. Okay, and compare this to the MAR for Amy Jenkins, sodium chloride. We have our sodium chloride. Okay. And we have our cefotriaxone right here. Okay. Alright, we have the correct medications. We have a correct tubing. Saline flush. I have my isopropyls right here. I'm gonna go ahead and put some gloves on to transfer my medication for extra safety. Okay. And then I'm also going to inspect both medications for any contaminants. They both are clear, as well as the expiration date. Okay. Knock, knock.
Hi.
Hi, Amy and Taj. Can I come in?
Yep.
Kind of already came in. Okay, so I have all your stuff, all the goods. How's your pain rating?
It's like at a 3.
Alright. And then, correction, I was actually bringing some more gloves. My gloves are still, there'd be gloves in the patient's room. I'll bring some gloves. As well as my labels. Hand hygiene. Okay. I'm just gonna go ahead and raise you up, okay?
All right.
And you told me you have no allergies, correct?
Yep.
And can you tell me some of the side effects that might occur?
A bad taste in my mouth, nausea, and diarrhea.
Alright. That sounds good. Clean for 30 seconds. Okay, and then we're actually gonna check the MAR. Correction, I would check the MAR to make sure I have the correct medication. This would be my third check. So we have the computer here, scan the patient for sodium chloride and cefotriaxone for, could you tell me your name and date of birth?
Amy Jenkins, 2784.
Alright, Amy, that's correct, okay. And then we have Amy Jenkins here, administering at 16:30, and it is 16:30. And we have the correct medications, not expired, no contaminants, and she knows the side effects, okay? And no known allergies. Alright, so that's my third check for the MAR. Then I would get back and I would start flushing the IV with saline or sodium chloride, just to make sure that we don't have any infiltration or anything like that. Does it hurt at all when I touch this?
Nope.
Clean for 30 seconds. Okay, then I would hold this up, making sure it doesn't touch the patient's skin. Place this up so I can use it and cap my thing again. Next I would unplug, ensuring that this stays up. And flush with 5 milliliters. Any pain there?
No.
I would inspect for infiltration or coolness around the area. Nothing. So we're good. Clamp. Okay. Clamp, no kinks. Put it back while I get my drip factor ready. Okay. Okay, next I'm going to hang my fluid. We're just gonna do it on here for now. Actually, we'll go to here. Hands up, please, that we have a hemostat here. So I'm going to get my primary line set first. And this part is sterile. So if I don't touch it, but it's all tangled, so I'll probably end up cleaning it with isopropyl anyways. So we're not gonna worry about that. But you could wrap it like this. Kind of like how you showed us. Okay. Correction, I would also make sure to just kind of touch my hand. It's sterile. There would be a cap on it, and I would take the cap off, but our stuff's getting used up. Okay, so I'd have this wrapped around like that. I would take the cap off of this, not touching it because that part's sterile as well. My hemostats, I might actually have to bend it back. There we go. Now it's open. Okay. Right when I take this out, the tubing you showed us, correction, I would put this all the way up. So I'm gonna put it all the way up. So I clamp it off so that water doesn't come spilling out all over us or we waste any fluids or medications. Okay, so it's clamped. I'll inspect the line, make sure everything looks good. No kinks, no contaminants. Fill this up about halfway. Next, I would come over to the patient. I would take this, clean the IV site for 30 seconds. Okay. There's air bubbles in it. Oh my goodness, I didn't prime. So I'm gonna go ahead and prime, Lisa. Holy crap, sorry, there's already fluid in here, so I forgot it was not primed. So I'd open this, and I would make sure, oh, I'm gonna actually grab the trash can first. So we don't get water everywhere. Unclamp, open my clamp. Is there any...
Are all your clamps open?
Yeah, they're all open. This guy has been sitting right there. There we go. Alright, Lisa, get comfortable. Guys, so next I'm going to get my drip rate, and we're looking for 17 drops per minute. So we want about 8 drops every 30 seconds, like 4 drops every 15 seconds. You're gonna want to pull up a chair. Ah. Okay.
Sorry.
You bump my IV back. This might be the one. Oh, this might be the one. Okay, here we go. Oh, this is definitely the...
Oh, for a minute.
For 1 minute. I'll tell you when to start. Ready? Start. After this drop. 1, 2, 3, 4, 5, 6, 7. Come on, 8. 8, 9, 10, 11, 12. Come on, big guy. 13, 14, 15, 16. Oh, it's 16 at a minute. Is that acceptable? It's gotta be 17.
I think 17.
Oh my goodness gracious. Okay, here we go. Dude, it makes the biggest difference. Oh, this is the one. Wait, let me double check. 1, 2, 3, 4. Actually, let me triple check. 1, 2, 3, 4. Yep, that's too fast. Gosh dang it, Lisa. This is frustrating. But I know it's for educational purposes, so it'll make me a better nurse. Okay, here we go. Okay, here we go, Elves. Here we go. We all got places to be. Amy's got dreams to dream. I need to get out of her hair. Okay, this is the one. I'm serious. Here we go. One, 2, 3, 4. It's just a second off. Oh, this is the one for sure. One, 2, 3, 4, 5, 6, 7. Oh, this is right on the money. 8, 9, 10, 11, 12, 13, 14. Come on, big guy. 15, 16 and a half on the minute. Oh, I'm so good. That was 16.66 per on the dot. Okay, so now we have our drip rates. This would be connected to the patient, but I guess I didn't connect it to the patient in the video. So correction, in order to connect it, it would be clamped like such. Did you get a video of the minute? Was it focused? Okay. So it would be clamped, still, primed, no air bubbles. I'll take the tubing out, plug it in, prime it, clean this for 30 seconds. And then plug this in, unclamp this, unclamp that, and adjust drip rate, but we were using the trash can because the arm has pressure and it's not giving us an accurate flow. So I would take this. This would still be sterile, but I'm gonna clean it. Clean this up. For 30 seconds. My cameraman's dying here, Lisa. 30 seconds, please. Okay, 30 seconds. Plug this bugger in. Unclamp, tape, and I would unclamp my IV tubing. Unclamped. Okay. Actually, now Amy, we're gonna throw in your antibiotic as well. Is that okay with you?
Mm-hmm.
Okay, awesome. So I'm gonna come in. I would leave the room, come back, hand hygiene, put gloves on, check the MAR again. But because I checked the MAR for both medications, we're doing both without checking the MAR. Because I already triple checked both. Come in. Undo that. Correction, I would clamp this before undoing it. This is an old IV, we would need new tape. Oh my goodness. Okay, we're just gonna put this in the trash can for now, pretending it's still in the patient. Let's see, come back here. And look at, make sure there's no contaminants, nothing like that. I'd get out my tubing. Keeping everything as clean as I can. Okay. I'd open this clamp so it doesn't spray all over me. It would come with something, it would come with this, and this is used. Probably should have done this before. Use that to hang that there. Next I would. Old label, my label. Okay, I'd hang it higher. After this, still clamped, I would prime it. Trying not to let any, because there's a medication and each drop is crucial to the patient. So I would prime it. That's what not to do. Primed. Oh, couple there. All right, we're looking nice and primed. Only dropped like one little drop. Got you, Amy. Okay. I'm gonna clean our Y port because that baby is exposed. It's actually not, but we're cleaning it for safe measures. For 30 seconds, gosh dang it. I always clean it a little bit, then I'm like, wait, 30 seconds. Honestly, I enjoy videos. They're fun. All right, that bug is clean. Okay. I don't technically have to clean this part because it's sterile and I didn't touch it with anything else, but it's my nursing practice. What are you laughing at, bro? My nursing practice? Jeez, Keely. What's the matter with you? Alright. Plug in. Just like so. Now I gotta adjust this drip rate factor. And to adjust this drip rate, I'm gonna open this all the way. But it's controlled by this drip. Kind of cool. I think so. Unclamp. Aha. Make sure everything's unclamped. Sorry, Amy. Okay, so technically this would already be in the patient. Again, I'm using the trash can as a patient because the arm, the pressure inside isn't allowing us the drip rate to actually work. But I would have cleaned the port for 30 seconds, cleaned this for 30 seconds, put it in, especially this because it was in the trash can. Plug it in, unclamp, check for infiltration and all that throughout this whole process. And dripping everywhere. And then I would start doing my drip factor. So technically this is in the patient, but it's not working for us. We're the Friday group and everybody else got to it. So this one we're looking for 67 drops per minute. Stop looking at me, bro. Trying to focus on drip right here. Oh my. A little bit slower than that. A little bit slower than that. Okay, this might be the one. That's definitely not the one. Hold on to your socks, everybody. Oh, this is the one. Okay, here we go. Here we go. Oh, this is the one. 18, 19, 20.
33, 34.
Okay, hold up. We're gonna restart it. Get it all ready. Okay, 45 seconds. We're gonna start the minute. And this is gonna be exactly 67 drops per minute, guaranteed. Start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 61, 62, 63, 64, 65, 66, 6. I'm so good. Okay, that's the drop factor. Literally the best nursing student to ever live. Okay. Okay, so this would be plugged into our patient. Now that we have this plugged in, everything is all good. Okay, plugged in. No signs of infiltration. No allergic reactions going on. And then let's see here. Let's start cleaning all my stuff up. Before I leave, actually, Amy, I'm gonna go ahead and label my drip rates, or my drips. So our tiny piggyback is our Cefotraxion. Please stay. The whole floor is soaked. And then our bottom one is sodium chloride. So what should happen is that when this is done emptying, then the rest of this will start. I would come back in 30 minutes and make sure that this is empty. Check on her, make sure there's no infiltration, make sure the IV is still good, no pain. If she is experiencing any like bad taste or nausea, diarrhea, I would help her out with that. Otherwise, that's pretty much it. Amy, how are you feeling, Amy?
I'm feeling good.
Good. Those antibiotics are gonna help with those kidney stones, or that kidney infection, and the sodium chlorides. That other big old thing of juice is gonna help you flush out those little rocks in your, basically in your pee system, your pee-pee. As my mother would say it. Alright, I know I'm hilarious, Amy. You don't have to laugh. It's okay. Okay.
Is this trash yours?
Sorry, Amy. Let me get that out of there for you. How do you feel? You might feel some coldness just from the medication and all that. You feel okay?
Yep.
Okay, I'll be back in 30 minutes to check on you. Maybe before then to talk story a little bit, check your symptoms and all that. Your vitals are looking great. Yeah? Any questions for me, Amy?
No.
Okay, I hope you... Okay, yeah, I won't say that. Okay. I'll clean up my area. And then before I leave, correction in the beginning, before I started the medication, I think I did, but I'm not entirely sure. The MAR, I would check my third check. I would check her wristband, ask her name and date of birth. And then check the MAR, scan it in, whatever the PMP, the procedure and policies are. But I would do my third check. I think I did, but I'm not entirely sure. Other than that, I would put her bed all the way down, call it right next to her in case she needs anything. And yes, and this would be plugged into her. And before I plug this into her, I would clean the end of this, clean the end of this, not let it touch the skin, unclamp, put it in, and then start. Yeah. Okay, I'm nervous. Okay, anyway. Jamie, you are my star patient. I'll be back in 30 minutes. Cool,
Alright, get out of here.
Okay. I'll just leave this bedside. Dispose of this. I would not leave this bedside. She could hurt herself. I would dispose. And I would go document that she's receiving her medication, and I flush 5 milliliters of sodium chloride as well. Or I'm gonna go to the documentation area. Bye, Amy.
Bye.
I document 5 milliliters that I pushed in just in case we're regulating input and output for the kidney infection, as well as 1,000 milliliters of sodium chloride. Actually, I wouldn't document that yet because it hasn't been infused like into her body yet. I would put it in motion. Other than that, I would log out of the MAR and I complete this skill.